Welcome, everybody. Glad you could join us tonight. Welcome to the July meeting of our nonprofit plant-based nutrition organization of Wisconsin, or PB Now. I'm your host, Terry Lynch. The mission of our nonprofit group is to educate, inspire, and support each other on an evidence-backed, whole plant food-based nutritional path for health and improved quality of life. Our group is open to everyone, those plant-based and those just curious about it. And it's meant to be a non-judgmental place to come, get information, inspiration, and support. If you'd like more information about our group, our upcoming meeting dates, speakers, and resources, or to check out videos of past meetings, just Google us at pbnow.org. That's pbnow.org, not .com, .org. As we do each time, can I see a show of hands of how many of you, either by raising your hands or the thumbs up icon on the Zoom bar down at the bottom, of how many of you are currently following a plant-based lifestyle? It's popping up. It's about half of the total so far. That's great. And let me also ask a quick question here, because I know there are a number of healthcare professionals on today. How many of you, if you could again raise hands or put the thumbs up, are healthcare professionals? That's good. We've got a number of them here. That's excellent. As we mentioned at the beginning of each meeting, the evidence of the benefits of plant-based nutrition in improving health and quality of life for people of all ages, as published in non-biased medical research, is quite striking. Whether it's improving health through increased energy, weight loss, preventing, slowing, stopping, or reversing problems like allergies, digestive problems, diabetes, heart disease, and early dementia, or increasing our quality of life by helping us feel better quickly, strengthening our immune system, increasing our endurance, improving athletic performance, speeding recovery from exercise, reducing joint pain, clearing thinking, or reducing the physical, emotional, and financial side effects of the illnesses, drugs, and procedures often recommended to treat the conditions plant-based nutrition can help us avoid. The research shows that our bodies do a wonderful job of healing themselves if we stop damaging them daily with poor nutrition and start giving them the nutrition they need to heal, to function optimally, and to allow us to enjoy every day for as long as possible. It's truly remarkable. Now let me tell you what's in store for you tonight. Tonight we'll hear from two speakers. Our first speaker will be our PB Now Medical Director, Cardiologist, Dr. Josh Lieberman, with some comments. And following Dr. Lieberman will be our featured speaker, Integrative Nurse Practitioner Becky Schultz, to talk to us about herbal teas. We should have some time at the end for when Becky finishes for questions at the end of her talk. Tonight's program should end about 7:30 p.m. And as a reminder, we have meetings every month, usually the second Thursday of the month at 6 o'clock Central Time. Next month, Thursday, August 10th, our featured speaker will be Yale graduate and head of the Rochester Lifestyle Medicine Institute in Rochester, New York, Dr. Ted Barnett. We'll be posting more information about our next meeting and other upcoming meetings on our website at pbnow.org. If you register on the website or are already registered, you'll receive email reminders of our events as they approach. As a quick technical note, during the meeting, everyone but the speakers will be muted, and we ask you to stay muted to avoid background noise and allow everyone to hear the speakers. All right, here we go. Our first speaker tonight is a fellowship-trained cardiologist. He is president and CEO of Wisconsin Cardiology Associates. He is past president and current trustee of the Wisconsin chapter of the American College of Cardiology, and as a member of the American College of Cardiology's National Nutrition and Lifestyle Work Group, whose membership includes nationally known physicians such as Dr. Dean Ornish, Dr. Caldwell Esselstyn, and Dr. Neil Bernard. He's an advocate for the use of plant-based nutrition to help improve heart health, general health, and quality of life, and has seen the benefits of plant-based nutrition in both his personal life and that of his patients. We are fortunate to have him here in Milwaukee and as our PB Now Medical Director. I'm happy to welcome Dr. Joshua Liberman. Dr. Liberman?
Thank you very much. Thanks as always for the introduction. I didn't make the meeting last week, so it's nice to be back with everyone. Hope everybody is enjoying the summer and getting out and getting some nice vitamin D and sunshine and all that good stuff. As always, thank you for the introduction, Terry. You're always so kind. And as people who have been on this call before, you all know that as the medical director, I like to do a little bit of introductory messaging before our main featured speaker. And usually I talk about a patient from my practice that I've seen recently and their results, usually on a plant-based diet, as well as talk about a little bit about some literature that's come up since the last visit. So I think we'll start with the anecdote first. And this is a patient I actually just saw yesterday in the office, an 80-year-old woman who came to see me thinking that she was doing very, very well overall. She's never had any heart issues. She's not aware of any heart issues. She exercises frequently, and she came to me saying that she eats an extremely healthy diet, focusing on, lower sugars. But when you question, when we started talking about diet, it turns out that her diet was more like one of these paleo Atkins type diets that was really high in animal protein and animal fats, including like the use of ghee, clarified butter when she was cooking. And I said, well, okay, all right, so let's talk about that, because she had blood tests done when actually, so I should take this back. I saw her yesterday. I met her for the first time 3 months ago, and we had this conversation about her diet. And we got labs that day, and her triglycerides were through the roof. Triglycerides are fat particles floating through the bloodstream that are a very good barometer of lifestyle. They're heavily influenced by diet and exercise patterns. And her triglycerides, and this is a little thin 80-year-old woman who's very active, and her triglycerides were 427, and they really normal for the human being is probably 60 to 80, but we accept up to 150, and hers were 427. Her LDL was also elevated. Her HDL was low for somebody who was so active and so thin as well. And so we talked about reforming the diet, and so we didn't start any medications. She really didn't want to be on any medications, and so we just talked about changing the diet, trying to move towards a more plant-based diet, and of course, getting rid of sources of like high saturated fat like ghee. And when I saw her yesterday, her labs dramatically better. Her triglycerides had dropped from 427 all the way down to 63. And this is without any medications whatsoever, right? It's like, a 90% decline in 80 to 90% decline in her triglyceride level. Her good cholesterol, again, she's already exercising, so she didn't increase anything. Her good cholesterol picked up from 48 to 64 with a change in the diet. And this more advanced test of bad cholesterol called the ApoB, the apolipoprotein B, dropped from 136 to 108. Now that's still higher than I would want it to be. But again, we're not using medications. This is just lifestyle alone. And I think it really highlights the potential impact that dietary changes can have. And just as another reminder of that, here, hold on one second. I wanted to call up another patient's labs. I'm sitting here in my office in front of my computer, which makes it nice and easy. And it was a younger guy. This guy is 41, and we saw him around the same time as her. So they're showing up 3 months later around the same time. Hold on. Why is that doing? Sorry. Give me 1 second here. I got to open up his note. So we have the spectrum. We have a 41-year-old and an 80-year-old, both with really high triglycerides, really high numbers, both just working on diet, no changes in medication, no changes in exercise or anything else. And this guy's triglycerides dropped from 356 down to 166. So still a little bit high, but he also did not go fully plant-based. And so he just started making some better choices, got rid of red meat, got rid of processed meat, eating more vegetables, eating more beans and lentils, and trying to incorporate some more of that stuff into his diet. So here we are, at kind of a spectrum of age, 40 years old, 80 years old, both with just diet able to dramatically improve their metabolism, dramatically improve their biochemistry, and not even to the maximum of what they really are, certainly the young man, certainly what he can do. But boy, was that profoundly encouraging for both of them to see, the power of diet and the power of lifestyle change. So with that being said, I also liked, as I do at every meeting, I like to talk about just a little bit of the research, and I don't want to take up too much time because we have some really interesting stuff coming up. I'd love to hear from Becky about, but I just wanted to highlight two papers that actually came out of something that I've actually talked about in the past, the UK Biobank database. So what is the UK Biobank? So it's a massive epidemiologic study of human health, of genomics, and of diseases. It began recruiting in 2006, and by 2010, it had 500,000 participants that volunteered to be part of this research study, this database, this observational study. The participants are 40 to 70 years old, and they came from all over the UK, hence the name UK Biobank. And here we are now, 10, 15 years later almost, and we are starting to reap the fruit of this data harvest, of this massive group of people, and these people had basically every blood test you can consider. They had genetic testing, they've had heart scans, they've had all sorts of different tests. And what we're just trying to see is linkages between different genetic patterns, different metabolomic patterns, proteomic patterns, and all these different things to see what their effect on health. And the two studies that I'm specifically going to talk to that were recently released or recently published were two studies on the topic of dementia, right? So dementia is a huge issue. It's something that I think all of us are really scared about at some level. The World Health Organization has reported that greater than 50 million people worldwide have dementia. This is a public health nightmare. Personally, it's scary for me. There's dementia in my family, so I'm always on the lookout for any research that sheds in some insight into how to lower the risk. Certainly, recently the FDA has approved some medications. So Big Pharma is desperately searching for its next billion-dollar blockbuster drugs, and so some of these Alzheimer's drugs that are being released aren't very effective, but they're charging $30,000 a year, $40,000 a year, $20,000 a year. So rather than let Big Pharma win with these huge windfalls for medications that don't even work very well, I think it's important to try to see if there's preventive therapies rather than after the fact reactive therapies, medications that react rather than prevent. So one of these studies from the UK Biobank looked at and confirmed the link between cardiovascular disease and the development of dementia. So in this study, the investigators actually created kind of a model of brain age, right? So some people talk about vascular age, you might hear about. Well, they kind of created a model of brain age, and they tried, the features based on MRIs of the brain that suggested, somebody's brain was older versus appropriate. And brain age was estimated in about 7,000 subjects that had no evidence of hardening the arteries and no heart disease or whatsoever. And they compared them to 1,300 patients that did have heart disease, that did have plaque buildup. And patients with plaque buildup in their hearts had higher brain ages and a 30% higher risk of dementia. When I say higher brain age, that means that you could be 60 years old and the appearance of your MRI suggested that your brain looked like it was actually 70 years old or older, right? And we know that they also showed that accelerated brain aging was also associated with diabetes and with different measurements of obesity. One of the findings that they saw in this MRI study was that patients with hardening of the heart's arteries, with heart disease, had lower volumes of most brain structures. So their brains had actually shrunk in size, and they were able to confirm this relationship with MRI data on the brains. Related, so that was the main point of that study, is patients with heart disease. So I'm a heart doctor, so it's important for me, obviously. Patients with heart disease have higher risk of dementia and older brains than they should have. In the second study, by a different group looking at the same kind of UK biobank, so a million patients, these researchers looked at the effects of different healthy dietary patterns in midlife and their relationship to later diagnosis of dementia. And they saw that greater adherence to healthy plant-based diets in midlife was associated with larger brain volumes later in life. So of course, I read these two studies. They came out within 2 weeks of each other in totally different journals, and the light bulb goes off in my brain, which hopefully has not shrunk that much. And I think these studies taken together tell us a lot about heart disease and dementia. We have definitive evidence that the same risk factors that lead to heart disease also lead to dementia. We know definitively also that healthy plant-based dietary patterns can prevent and even reverse heart blockages, atherosclerosis. And now we know that not only is this dietary pattern healthy for the heart, but there's suggestion now that it can also prevent dementia, as it would lead to higher brain volumes as we age, instead of the shrinking that happens, certainly with patients with heart disease. So those two studies together seem to me to be worthwhile talking about at this meeting. So hopefully everybody can take this to heart and remember, with your larger brains, to try to eat healthier and observe healthy lifestyles. So with that, we can leave it to Becky Schultz.
Thank you so much, Dr. Lieberman, for that great information and the puns as well. So our featured speaker tonight, I mean, that was incredible information. Holy man. And the changes in the patients, my goodness, with no medication.
Yeah, I'm not trying to take away any time from Becky, but boy, is it rewarding being in this field, really focusing on counseling lifestyle, and just seeing honestly the joy and happiness in people's faces when you can tell them that their numbers got so much better just with lifestyle changes, and that they've moved them out of high risk, they moved themselves out of high risk categories. It's really rewarding.
It's wonderful to hear that, being that I just saw something on physician and healthcare worker burnout from people who are restricted to a certain amount of time and don't see any improvement in their patients. The addition of lifestyle medicine is making a heck of a difference in not only the patients' lives, but that of the providers or the healthcare professionals.
Yep.
Well, thanks again. And Becky, our featured speaker tonight is an integrative and holistic family nurse practitioner. She's been counseling and treating patients for close to, or I don't know if it's over 30 years now. She earned her bachelor's and master's of science in nursing here in Milwaukee at the University of Wisconsin-Milwaukee, and completed her integrative medicine fellowship and integrative health coaching education at the University of Arizona's Andrew Weil Center for Integrative Medicine. She is nationally board certified as a family nurse practitioner and a certified holistic nurse. Among other certifications, and this one is particularly relevant tonight, she is a registered herbalist with the American Herbalist Guild. She has a long list of professional accomplishments, but in particular in 2015 and 2016, she received 2 alumni awards from the University of Wisconsin-Milwaukee, the Community Service Award from the UW-Milwaukee Alumni Association, and one of the 50 Distinguished Alumni Awards in conjunction with the College of Nursing's 50th anniversary. I'm happy to welcome our featured speaker tonight, Becky Schultz. Becky?
Hi, everybody. Welcome. And Terry, thank you so much and for the kind introduction and for all that you do with founding and continuing on with this really cool organization that you started pre-COVID and pivoted to the virtual, which made it more available to so many people across the state and beyond. And I'm just really honored to have been asked back again. Thank you for inviting me. And thank you for all the work that you do. And also, Dr. Lieberman, thank you too for everything that you do with the leadership. And I don't know, I could just sit here and listen to what you're having to say because that's such powerful information. So if anybody wants to like just delete me, well, let's just keep going with Dr. Lieberman. But just, kind of kidding on there, but I really appreciate what you're saying. The power of nutrition is so important, and lifestyle in general is just so important. And I think as clinicians, we need to talk the talk and walk the talk and walk the walk. And so I think it's really, really amazing. So I'm going to see, I think I need to share screen now, Terry. So are you going to give me permission for that?
Yeah, let's do that. Sorry about that. Whoops.
And then I just want to say hello and welcome to everybody that's on tonight. And I know some of you are lifelong PB Now attendees, and others are peeking in for maybe the first or second time. And I'm honored to be invited. There's certainly a lot of amazing speakers that get to come here, and I'm a local person, so I'm very excited. I'm also an integrative and holistic consultant with the Advocate Aurora Integrative Medicine Department, and I'm only doing virtual visits now. So both in Milwaukee and in Wisconsin, and soon to be in the Illinois area as well. So I'm very excited about that opportunity for my patients as well.
Excellent.
So let's see if I can share here. My talk tonight is talking about integrative and plant or herbal medicine. And specifically, we're going to be looking at the use of teas because this is plant-based medicine. We're always talking about food as medicine, and we're going to look at herbs as medicine, which they are, and teas in specific to enhance your health. So I'm going to be talking with you a little bit about integrative and plant/herbal medicine, just so you have, and I'm sure you already probably know that, but I'm going to just define it a little bit more. And then we're going to talk about just kind of the overview of how you can extract the medicine from the plants and how you can prepare them. And again, specifically talking about teas, also known as tisanes. And then what we need to know when we're choosing herbal medicine or plant medicine for health and wellness. And then we're going to discuss a few different teas for wellness and health. And then I have a case that we're going to review from an integrative perspective and using teas in that therapeutic plan. And then just looking at the rainbow of tisanes or teas, just like in plant medicine, we like to say, put your plate full of a variety of color, or use the rainbow because of all the different types of foods, the flavors, the textures, and there's just so much variety in the nutrients that you get from that. So when we look at integrative medicine or integrative health or integrative whole health is kind of one of the new terms that we're hearing a lot more. This is both a philosophical and a practical approach to healing-oriented medicine or healthcare that takes into account the whole person, that mind, body, and spirit, and really wants to focus on lifestyle. And we heard about Dr. Lieberman's work and focus on lifestyle, and so does integrative medicine, and so does herbal medicine like to do that. And I really think that that's at the core of where, if anybody really wants to get their health back or to maintain their health or optimize their health, I would say lifestyle is really where it's at. And that's what we talk about a lot here. It emphasizes the therapeutic relationship between the practitioner and the patient, and we really want to make sure we're partnering with the patient to do shared decision-making and finding out what it is that the patient is looking for, and then also pivoting it in the way that will best help them. So for example, with Dr. Lieberman, he had a patient that had thought she was really healthy, thought she was eating really healthy, and wanted to not use medicines. And we can see that medicines can be avoided, or maybe lessen the amount, or maybe removed, or used judiciously when we can't always do it just with lifestyle. So we don't really throw out the use of medicines, but we want to use them judiciously along with the cornerstone of health, which is really lifestyle. We're informed by the evidence, and the evidence can be randomized controlled trials, systematic reviews, and meta-analyses of those, along with the evidence of a clinician. So when Dr. Lieberman talked about his anecdote, that was his anecdote, then he supported it with the literature. So he's got the experience with that, and that's what we like to look at too. And then we also like to take into consideration what the evidence is of what the patient's been doing, and then make use of all appropriate therapies, both from the conventional world and the integrative world. We really like to encourage the use of the least costly, least invasive, and least toxic therapies when able. However, that's not always possible. Sometimes people do need to go through and have something that's more invasive for whatever reason, or more, things that maybe are more costly or maybe even toxic. But we can oftentimes incorporate various lifestyle and integrative approaches to help with the management of those, and perhaps help once somebody is more stable to go more that route. So plant or botanical, also known as herbal medicine, is an approach, again, that looks at the whole person for approach to wellness and healing that uses plants or plant-derived preparations to promote health, prevent, treat, or cure a health condition or various ailments. Plants are incorporated, and herbal medicine is incorporated into many various medical systems around the world for a millennia. Really, if you go around the world and see, plants have been figured out as to how to use them medicinally. And we certainly know that in the world of food, we've heard that Hippocrates says that let thy food be thy medicine and the medicine be thy food. And we could also say, let thy tea be thy medicine and the medicine be thy tea, or the rest of the herbs. And for example, some of the various medical systems around the world, we have traditional Chinese medicine or Ayurvedic medicine, that they have many different aspects of their medical system, and they oftentimes incorporate the use of herbs. We also have that in naturopathic medicine and integrative medicine, functional medicine, and many around the world. It's interesting that about 80% of the world's population uses medicinal plant preparations for their primary health care needs. And we certainly are seeing a reemergence of that within the Western world, and especially in the United States, because it really kind of got flattened out early in the 1920s for various reasons. But despite this extensive use of plants in traditional medical systems, our knowledge of the plant and their values really remains largely unexplored. But there is a lot of literature out there as well. So I don't mean to say there's not, but there's a lot of plants that haven't been explored. And so that's really pretty amazing to think that we have that in our potential for benefits. So when we think about plant parts that are used, it could be, depending on the plant and depending on the reason for what we're using the plant for, or the herbal medicine for, it could be a different part of the plant. So we have the aerial parts of the plant, and we have, which are above the ground, and we have the below or the underground. So for example, a bud such as clove bud, flowers such as lavender, chamomile, calendula, fruits such as lemon, orange, bergamot, seeds such as milk thistle or cardamom, a leaf such as peppermint or perhaps lemon balm, bark such as a cinnamon. And many of these are culinary, as you can see, and they oftentimes were used from a culinary standpoint, not only because they enhanced the flavor, but they had therapeutic properties of preservation of the food because of the antimicrobial properties. So not only did it create the various flavors from around the world and the footprint of the flavors around the world, but it also enhanced the preservation. So the below or the underground, we oftentimes know about roots. We know about root vegetables, and astragalus and ashwagandha are roots that are used medicinally, and rhizomes. So rhizomes are the underground stem, and oftentimes confused with the root, but the technical word for it would be a rhizome. But you'll probably hear, and I probably will say it, because a lot of times we all say turmeric root or ginger root, but it's actually an underground stem. So what makes an herb or a plant therapeutic? And we hear a lot in plant-based nutrition about the macronutrients, and this is the chemistry of the plant. This is what makes the plant therapeutic, and it's the chemistry. So we have the macronutrients and the micronutrients, and we frequently talk about those within the food that we eat. And the macronutrients are the large molecules or the large nutrients, which are proteins, fats, and carbohydrates. And sometimes we hear people taking more or less of those for various fad diets or whatever. And we also hear about the micronutrients and the benefits of the macronutrients and the micronutrients working together. So the micronutrients are the vitamins and minerals. And then, of course, there are the water and the fat-soluble vitamins, such as the fats would be the A, D, E, and K, and the water would be the B and the C's. And they all work synergistically together. Phytochemicals are secondary metabolites of a plant's production, and they're usually there to help protect the plant, because the plant can't get up and run away from somebody like we could, or we could close the door if we didn't want to talk with someone. They have to be out there in the elements, the sun, the wind, the rain, the dryness, the animals, the insects. And so they develop chemicals to help protect them. And humans all over the world with their various plants have figured out that certain plants have benefits for certain health issues. And it has to do with these secondary plant chemicals, and it's oftentimes in the pigments of them. So when you get all that rainbow of your food color, you're getting all these different phytochemicals. And it is phyto, P-H-Y-T-O, not F-I-D-O, like my former boss and I, when we first learned about phytochemicals, we thought they were talking about the dog, phyto, but no, it isn't. But you can see, like, we have green tea catechins, gingerol and shogalls are coming from ginger, curcumin and turmerones are coming from turmeric rhizomes, anthocyanins, those are those dark purple phenols and polyphenols, oftentimes in teas and all kinds of vegetables and fruit. And then we have the essential oils of the plant. So these are the volatile essences of the plant. They're very lightweight molecules and very small molecules, and they are what give the plant its aroma, or the aromatics of it, and they evaporate fairly quickly. So when you think about maybe a peppermint leaf, or if you rub up against lavender and you smell that, those are the essential oils of the plant. And when we look at the plant in its whole versus the isolated constituent, those plant chemical constituents have synergy. They work together, and they can kind of up or down the need for the phytochemical benefits of it, and it helps to keep it balanced. Versus if we use an isolated plant constituent, that can become more like a pharmaceutical agent. And oftentimes, I think it's about 20% of our pharmaceuticals now are a plant derived originally, and then they can develop the synthetics. But back in the early 1900s, we had a lot of herbalists and we had a lot of eclectic physicians that knew a lot about how to use plants in therapeutic properties. And then over the years, it kind of moved away. But when we use plants, and we do have plants that you can buy, herbal supplements that are plant isolated constituents, such as curcumin, which is a plant chemical constituent of turmeric, as well as turmerone, but it oftentimes is that. And there can be benefits for that. And there also can be risks associated with that, but there can be reasons that you might want to do that. So how do we get these plants into the ability for us to be able to use those? So there are various methods of extracting or preparing for our use as humans. So one is we can use it as food. So we might be using our herbs and spices, or there might be a particular food that could be used for both herbs and spices and medicines that way. So that's one way to do it. So we can just chew it and eat it and let our body digest it and absorb it, and all the aspects that take place with the digestive processes. And then you can use water-based extraction methods such as in teas or tisanes, which we're going to talk more about, and decoctions, which are just an extension of that, where you're simmering. Steams are just basically letting the steam come up, and that's where you're using the essential oil aspects of maybe breathing it in and opening up the nasal and sinus passages, and compresses, which you'd be using like a tea or a water-based extraction, where you're applying it as a compress on like a boil or a sprained ankle or bruise or something like that. Hydroethanolic or water alcohol, this would be something like a diluted Everclear, which is like almost 100% alcohol, or perhaps a vodka or a brandy. And that extracts both the water and the alcohol constituents, where the water-based just does the the hydrophilic or the water-loving, water-soluble constituents of the plant. Glycerides is another way of making like a tincture, but not with alcohol, and it doesn't have quite as strong of an ability to extract as hydroethanolic, but it's stronger than water. And this is oftentimes used for those who may not want to have alcohol or shouldn't take alcohol for various reasons, or they don't like it, or for children. And it's a very nice way of making extracts. Vinegars, many of you are probably familiar with doing an infused vinegar. And then if you infuse the herb, and that's oftentimes used culinary ways, and that's how we can, again, use food as medicine. And oxymoles are just adding a honey to the infused vinegar. You can also do an herbal honey infusion where you take a plant and you put it in the honey and you let it sit for a while, and then you would strain that out in a few weeks, and probably have to warm your honey up a little bit so you can strain out the plant part. An electuary is actually using a powdered part of a plant, and you leave it in there. So it's pretty finely powdered, and then you can just take it right away. It's a good way to take things that maybe kids might like to take as long as they're over a year, because honey, you want to make sure that they don't get exposed to the botulism toxins. Oils, you can infuse oils in it and make ointments and balms and lotions and creams and many types of things. Syrups are just adding a sugar or honey to one of the water-based, and poultices is using the plant directly on the body part, like an abscess or a bruise or an insect bite. And powders would be just taking the herbal plant part and drying it and then powdering it. And then essential oils would be where you extract those with various methods, and you get this highly concentrated part of the plant that has the aromatics and the essences. So today we're talking more about teas and tisanes. This comes from a Greek word called tisanes, or P-T-I-S-N-E. And if any of you are Greek, you can say that for me. But this is the use of crushing the herb, and it could be either fresh or dried herb, and using it as a medicinal beverage. I know a lot of people know a lot about making teas, and you probably have been doing this your whole life. And sometimes we use the teas more as a flavored beverage, but you can also use it therapeutically as well. It's usually using water as the solvent, but you could use perhaps a juice, or like an apple cider, or milk, or a dairy milk, or a non-dairy milk. So why would we want to use this? Well, one of the things, just talking about it again, is water is a solvent, very easily available, and the plant part is the solid part of the solute. So the solute, or the solid part, is going to get the chemical constituents from that are going to get absorbed into the solvent of the water. So the benefits of it is really easy. It's affordable. It's easily accessible all over the world, and it extracts the water soluble or the hydrophilic, water-loving plant constituents, or the plant phytochemicals. This is the most common way of herbal medicine making or herbal extraction around the world. And if you think about it, people all over the world for the millennia, we have people are growing or wild harvesting the various plants that grow in their community, and then they can dry them and they can store them so they can use them year round. And so it's what the most popular way is, and it's easy and it's affordable. Most anybody can do that. Some of the limitations, you can't extract the alcohol or the fat soluble constituents. And because water does not have any type of preservation to it, it's perishable. You've probably seen that before, where you've left a cup of coffee or a cup of tea on your desk or something like that, and gone back a few days later and there's mold growing in it. So it really needs to be consumed pretty quickly after you've made it, and then store the unused part for maybe 3 to 7 days or less, depending on whether it looks off, smells off, tastes off, and the reason for it is because of the lack of preservation. So how do you make this? And you probably already know how to do it, but you want to get your equipment or your supplies. You want to have your plant part. It could be fresh or dry. And right now, you probably are growing some of your own culinary herbs, such as sage or thyme or mints of various flavors. Or you might be out, if you like to go out and harvest in the wild. It's called wild crafting. So you can get the fresh, or you can buy dried, and it could be either loose leaf or loose plant part, or in a tea bag. that's already prepared. And if you like, you can prepare those yourself in little tea bags, or you can buy them already pre-made, which is probably what most people do. And it's available pretty much all over the place. So if you go out to dinner, you can get a tea and you can tea bag, and you can do that, or wherever you are. And it's oftentimes the aerial part. We usually want to use either distilled or filtered water, but you don't absolutely have to. But oftentimes our water has chlorine or fluoride in it. It can inhibit some of the absorption of some of the plant chemicals. And then you want to have a teapot or pan or some type of a utensil for you to be able to boil the water. And then you want to have a heat resistant coffee or teacup or mug. And that's pretty much it. So you can see how easy that would be to have that available to you. And then what you do, I'm going to talk with you about hot infusion and cold infusion. And I'm going to start with a cold infusion. This is something that I really like for the use with patients that are maybe struggling with not wanting to give up their soda, or they don't like to drink water. And yet, they're drinking a lot of soda. And sometimes if you talk with them about using the cold infusion method, and sometimes you probably are familiar with this too, when some people do like a sun tea or a solar tea or a moon or a lunar tea. So basically it's not using a heated method, although the sun rays are coming down. Lots of times people put them in a bag versus just putting it directly in the sun. But you put your herb part in the mug, cup or glass container, and then you pour the water over it. And you let it infuse for at least 2 to 4 hours, but some people even do it for 24 to 48 hours, and then you consume it. And then just like anything with the water infusion, you want to use it up or refrigerate it and discard it if it looks off. One of the plants that is oftentimes used for cold infusion is something like marshmallow root, because marshmallow has a lot of polysaccharides, which are a form of a carbohydrate that are very mucilaginous. So it's kind of that gooey stuff that you see when you make oatmeal. And if the oatmeal and the water separate, that kind of gooey stuff, that's actually, and when you mix it up, it goes back into, it's suspended back into your oatmeal. But that is actually a good part of what we do when we do marshmallow root that can be used for mucous membrane healing, perhaps for canker sores or sores in your throat or sores in your esophagus or your stomach, or even down to the bladder it can get. And so the reason that you would do that is you don't want those mucilaginous polysaccharides destroyed, but you can also do it just for the flavoring aspect as well. And you do get some of the chemical constituents out of it, but not probably as much as when you use a hot infusion. So a hot infusion can be done in a number of different ways. And you again get your equipment and have your boiled water. Herbalists oftentimes use the term near boil or just off the boil. And you put, usually if it's a dried plant part, it's 1 to 3 teaspoons of dried. And if it's, this is not exact science unless you're using a lot for truly medicinal purposes, then you don't want to be doing excessive amounts, because just like with anything, sometimes people think because it's natural, it's just completely safe. And we know that even if you eat peanuts, some people are allergic to that and can die from that. So same things with anything that we use with herbal medicine, just because it's natural doesn't always mean that it's without any risk. So you always want to be thinking about that. So and with a fresh plant, you can use more because it still has its moisture in it. So you might use something like 2 or 3 tablespoons. And then again, you pour it over the water and then you let it sit. And this is a really important part of this, is you want to put a lid on it, because once you start seeing the steam come up, that's actually the evaporation of the essential oils that are coming out. You can smell it. It smells really good. But what you want to do is you want to put a lid on top and then let it steep somewhere between 5 to 20 minutes or so. And then when you take the lid off, you want to let the condensation that's accruing on top of the lid, you don't want to just let it drip all over your counter. You want to let it drip back in, because that does have the essential oils in it. And again, you have that whole plant part that's working synergistically with it. And it also enhances the flavor. But I think a lot of times we don't really think about it, but that is something, and that's one of the reasons we all get to smell coffee, because I think a lot of people don't have a lid on top of their coffee. But you can do this in a lot of different ways. You can use just a teacup and pour hot boiled water just over top of the plant part, or you could put it in a tea press if you wanted to, and that would be where you're using the loose tea part or the loose plant part or a loose tea. And then you could use it with the tea bag. And I like to do all of those different ways of doing it. And then you can also do a long infusion if you wanted to. And that would be where you would, I can show this to you when we're done. I'm going to give you a little bit of a demonstration, but you can do a long infusion, which can do 4 to 8 hours or more. And that's more of like a nutritive use of herbal plants and teas. Okay, so now when you're thinking about using herbal medicine or herbal teas, these are some important factors to consider. So one is you want to be thinking about yourself or who it is that you're recommending it to personally or professionally. If you're a clinician, you want to be thinking about who is this person that would like to use this? What is their age? Are they a special population? Might they be pregnant or are they pregnant? Are they nursing a baby? Is there an infant or is this an infant or a child or a senior that may have different pharmacokinetics going on or the way that their body manages that? And then, of course, we want to be thinking about what their beliefs are. And so for me, over the years, I worked in primary care until just recently. And when I would recommend, and even now when I recommend the use of various teas or herbs, it's just a wonderful way for me to bond with my patients because they have oftentimes some history from wherever they came from or their family came from within the world. And some people, like Dr. Lieberman said, they want to have a more natural way. They don't necessarily want to go on medicines. And again, it's not that we don't use medicines. It's just that some people, that's what their belief system is, and we want to partner with them. I would also say for yourself is maybe think about why would you maybe want to use a natural approach to your health or herbs or weeds or whatever when you're using this. And just ask yourself, why do I want to do that? Who has influenced me with that? Have I had any experience with it? Is it something that my family embraced? And for me, I had Grandma Thule. Grandma Thule was from Switzerland, and she had a book called Herbs and Weeds, and it was written by Father Johann Kunzli. And that was very common for the priests and the monasteries to keep the knowledge of the plants. And so Grandma used that all the time. I didn't really learn a lot directly from her, but I saw her going out and collecting the weeds, wild harvesting and bringing it in. And they lived until 89 and 93, my grandma and grandpa, without really much health problem. They also ate really healthy and they had a big garden. So I think that's a really important part of that. We also want to know, what is the person's medical history? Do they have something that we need to be careful of when we choose this? And what medications or allergies might they have? Because that could potentially impact as to whether we would or wouldn't recommend something, or is there any potential for a drug-herb interaction? We always want to be thinking about why are we thinking about using it? What's the purpose of it? Is it something that's acute, that's like just happening now and it's short-lived, or is it something that's chronic that you would take it? If it's acute, it's usually something that you want to get on board really quickly, like echinacea, and echinacea tea can be used very quickly in high doses and frequently for short periods of time. You don't want to start that 3 days into the respiratory infection. Versus maybe hypertension, where you might want to use hibiscus tea or hibiscus and hawthorn tea, maybe a little bit not as intense doses, but over a longer period of time while you're also working on diet and other lifestyle as well. And I'm not saying not to take your hypertensive medications. I've had patients that have just dropped that off without, even though we've talked through plans, and then they come back and their blood pressures are pretty high. Then we have to go back and work on all the other aspects of how you can do that safely. You also want to be thinking about the safety and ethics of herbals, the use of herbs, and you want to make sure you have the correct genus and species. You want to, and the correct plant, and you want to know how to identify it if you're wild harvesting. You want to know about interactions and adverse effects. You want to know about the product quality and the source for where you're getting it. Because a few years ago, ashwagandha was being adulterated, and it's very commonly wanted to be used. It comes from the Ayurvedic medicine of India, but it was being adulterated. Another thing that happened a few years ago, and I'm not exactly sure what happened, but kava was a plant that I really thought was very interesting to use, but people were getting liver damage and kidney damage from it. And my sister's friend's sister actually did and ended up dying after getting transplanted from it. So it made me stay away from kava for a long time, but it ended up that it was supposed to be the root and not the above or the aerial parts of the plant. And that was perhaps some of what was going on. But if you do ever use kava, You want to make sure that it's in a water base and it's not with somebody that's got a lot of liver issues going on. And then you want to make sure that it's sustainable. So if you're harvesting yourself, you don't want to be using anything that's endangered, such as echinacea in the wild, because it's on the United States plant sustainability list. And if you are harvesting in the wild, when it's already cultivated the same genus of species, you're really putting the plant at risk. And then sustainability, you also don't want to take more than a third of the plant if you're out there taking it, because the wildlife might be wanting to use part of the plant, or there may be other people. And I'm pretty sure in England, they have a ban on people doing wild crafting in areas that, because so many people are using it. So this is a really important part as a clinician and as a person that's thinking about using this, or anyone that's recommending this for anyone, is that are there potential drug-herb interactions? And there could be, and this is where we have to make sure we think about safety. Could it impact the absorption, the metabolism, or the transport of the drugs by affecting, with the herbs affecting that? Preclinical data suggests that there's many herbs that can have that, but the pharmacokinetic studies show that really there's not that many that have clinical significant interactions with most drugs, but they still can be. And one caveat that we want to be thinking about is that if someone is on a drug that's really super important for them with a therapeutic range, and if they didn't get the effects, or they got too much of the effects because of the herb drug interaction, that they could get into trouble, you really need to be more cautious about wanting to use that. So someone that's on a blood thinner, if their blood is either too thin or not thin enough, they could run into a bleed or a clot, or maybe anti-seizure. If it doesn't work, then they run the risk of getting seizures. If they are on an anti-rejective for a transplant, they could potentially get into issues with rejecting the organ that they've gotten, or even with birth control and St. John wort, which has benefits for mood. If you use that, St. John's wort interferes with many, it's got many metabolic interactions with many drugs. And if they were to use that with birth control, they might end up with an undesired pregnancy. There are ways that you can do drug-herb interactions. Many of us use natural medicine database or micromedics in the medical world, but there are other ways of doing that as well. So now you're thinking, okay, well, what am I thinking about doing here when I use my herbs? And adaptogens these are the plants have many chemicals in them, and it's the chemicals within them that help to give herbal actions or their therapeutic benefits. So there are many. I have just listed a few to give you a taste of what you might want to use them for. So adaptogens are a class of herbs, herbal actions that help us to adapt to the various effects of stressors. So it could be an emotional stressor, or it could be a physical stressor. So it could be where we're stressed out because we're worried about something, or maybe we were injured, or we have an infection, or we've been sick for a long time. And the body doesn't know the difference between what it is from a standpoint of the HPA, which is the hypothalamic pituitary adrenal axis, where it's the fight or flight response that our body does. And so these herbal adaptogens can help us, and they help us to have resistance. And some of these herbal actions, the names sound familiar to us because they're similar to what we use for pharmaceutical actions, but some of them are very different. So anodyne means to decrease pain. So does analgesic. That's one that we hear more. Anti-inflammatory, decreasing inflammation. And inflammation is oftentimes something that is contributing to many of the health issues that people have. Carminative helps to relieve gas, both above and the below, and demulcents help with soothing the mucous membrane, such as what I was mentioning before with regard to marshmallow root. Hypotensive, instead of antihypertensive, they refer to it as hypotensive. So this helps to lower the blood pressure. Immune modulating helps to modulate the immune system. Nervine relaxant sounds like what it's going to do, or an anxiolytic. It's going to lyse or decrease anxiety, or decrease, help with relaxation. And a soporific or a somnorific helps with sleep. So you can see why this may help with some health and wellness. This is basically the same there, so I'm not going to go on that slide. Here are some of the herbs that fit in with some of those categories that we're going to be looking at with our case. So here we have ashwagandha, and I'm just going to change something here on my screen. And ashwagandha is a root. It's Withania somnifera. So that's the genus species name of it. Somnifera means to sleep. Withania means strong horse urine, or strong horse. So it's going to give health and resistance and help perhaps with sleep, but it's not a sedative type of an herb. It's the root. You can see here that the root is dried and cut, and then here it's powdered. It has many different herbal actions, therapeutic properties to it. An adaptogen is one, as I mentioned before. It has anti-inflammatory and actually helps with stress as well, and immune and for anxiety, I should say. Chamomile, Matricaria camellia, it's such a beautiful plant. You can see it looks kind of like a tiny little daisy, and it is in the daisy family or the Asteraceae family. She, and lots of times herbalist refers to plants as a she, so sometimes I do that. So if you wonder why, that's why. But this plant has anti-inflammatory properties, antispasmodic, nervine relaxant, so helps with relaxing, and carminative, so it helps with a lot of things that would go on with the stomach, or with also the nervous system where we're feeling kind of anxious, or the nervous stomach. Echinacea, we talked a bit about that before. It's actually called purple coneflower. One of the genus species of this is Echinacea purpurea and angustifolia. There are many different species, but these are two of the most common used for immune modulating, and antiviral. Also has some antibacterial properties. Ginger or Zingiber officinalis, this is the rhizome, and you can see over here, this is when it's dried. You can use it fresh or dried, anti-inflammatory, antiviral, and anti-nausea. Many times people use it for chemotherapy or pregnancy, or even motion-induced nausea. It's got a great flavor. I oftentimes use it personally for when I'm starting to feel like I'm getting a respiratory infections from the antiviral. I really hit myself kind of hard. I probably am taking some of these other things as well. Green tea, this is actually when somebody says they're having a cup of tea. This is a plant called Camellia sinensis, green tea. So it can come in black, green, white, oolong, and black, and even pur'u, where it's the same plant. And this is one you definitely would want to get organically, because much of our tea comes out of China, some out of Japan. Out of China, there may be a lot more heavy metals contaminating it, which can cause problems along with the poor diet, but that could contribute to cardiovascular as well as brain health issues. So it would be something that you wouldn't want to, you want to do organic with it. My husband does a lot of green tea in the cold infusion because he likes to have, he likes that taste better than just plain water. And he likes the benefits of some of the caffeine. And green tea actually has both uplifting and calming aspects to it. Because it has the caffeine in it, but it also has something called L-theanine in it, which is a relaxant. It has anti-cancer properties, antioxidant, antimicrobial, antiviral, anti-inflammatory, antipyretic, meaning for fevers, analgesic properties, and cardioprotective, and some benefits for the lipids. And you can see the rainbow that we're having here: purple, we have white or yellow, green, this pretty red, fuchsia color almost, and the orange, yellow, and then green over here. So again, you're getting a wide variety of plant constituents here. Then we have hibiscus, Hibiscus rosa sinensis. This is oftentimes called sour tea, and lots of people, I think in the Mexico drink that. And it is, I really like it. It is sour. If you don't like it so sour, you could add a little bit of stevia leaf or perhaps honey to make it a little less sour if you don't like that. And it helps with blood pressure. Peppermint or Mentha piperita, one of my absolute favorite, both herbal and culinary benefits, has anti-inflammatory, antispasmodic, and analgesics. And then we have turmeric, which I only put 2 things up here, and it has just a wealth of herbal actions and therapeutic benefits for us. It's Curcuma longa is one of the species of the Curcuma genus, and has anti-cancer properties as well. So really just here with a few herbs, you can see how powerful this could be if you chose to incorporate these in, just like if you have other fruits and vegetables and plants in your life. All right, so here's a case. This is a person who is 50 years old, female. She's single mom, adult kids, and she's a certified nursing assistant. So you can imagine right there, she's single, she's a mom, her kids are adults, but she has some grandkids that come over and she loves them, but sometimes it can be stressful with them. And being a certified nursing assistant, most of us are very grateful to the certified nursing assistants. They do a lot of work for us, and that's a stressful job. She has mild borderline, kind of pre-hypertensive to stage 1 hypertension, mild gastritis, no GERD, but sometimes these things go together, so we don't know for sure, but you want to be mindful of that because peppermint could potentially be adverse, cause adverse reflux for her because it lowers the esophageal sphincter of the, and it could potentially let some of the gastric juices or gastric secretions back up the hydrochloric acid into the esophagus and cause some of that. And she has some gas, mild left knee pain, breast cancer history, but it's been several years and it was in the early stages. She has mild insomnia and mild fatigue from not always sleeping the best. Here are some of the medicines that she takes intermittently is naproxen, which is also known as Aleve or naproxen. It's a non-steroidal anti-inflammatory that's used for pain and fever, and she uses that for her knee pain. Multivitamin, and she's postmenopausal, so she doesn't use it with iron, but if she was premenopausal, you'd probably want with iron. She uses Tums occasionally, which is calcium carbonate for the most part, and she uses that for her stomach. And so she's sometimes doesn't use it all the time. And then diphenhydramine, which is common what people use to help them with sleep because it has some sedating effects for it, but it has also some adverse effects for it as well, but it can help people to sleep. She's also on allergies, and she's coming today because she wants to talk about maybe not having to take medications for blood pressure. She wants to address her stress and her sleep and pain and immune protection. And so we always look at lifestyle. And I'm not going to go into it in great detail, but you can see there are 7 core areas here of sleep, nutrition, movement, resiliency, spirituality, relationships, and environment. And her nutrition, she's pretty good, but she has some room for improvement. Movement, she's doing 3 to 4 days, but she, we like to get at least 5 days of about 30 minutes of moderate exercise. So about 150 a week is usually good. So she has some room there. She's a little bit overweight. I don't know if I mentioned that before. So working with her for the plant-based and movement can be helpful for her knee, helpful for her blood pressure. Perhaps we know that when we have overweight, we're at a higher risk for cancers. And sometimes if people carry their weight in their belly, they also have more weight pushing on their belly and might have some impact on her gastric reflux or gastritis. And then she does some breathing. She likes nature and she's got pretty good relationships, and she does do some organics, but not always. But organic would be important for our food if we can. Not everybody can because it does get expensive. And I was just out grocery shopping earlier today at a health food store, and I was just amazed at some of the prices. I'm just like, whoa. But there are places that you can get at farmers market, but not all farmers markets are organic. This is going the next step at looking at what she's doing and just taking what we learned about the teas that we spoke about. So again, she's got that mild borderline, hypertension to maybe a stage 1. She's got the stress, the sleep, the fatigue, the knee pain, cancer risk reduction, and immune protection. I forgot to mention too that she does have sometimes when she gets stressed, she easily gets more respiratory infections. So here we're talking about using tea or tisanes in a single or a blend that you can use all of these. You can mix green tea with peppermint, or you could mix peppermint with hibiscus or whatever. You can make it kind of fun, just like when you're cooking. So green tea has the cancer risk reduction, and she does have, and when you're doing that, you want to be doing it consistently. It's not like, okay, I did that once and now I didn't need to do it again for another 3 weeks. And sometimes people will say, yeah, I've done that like maybe once or twice a week. Probably daily, 1 to 3 cups per day can be beneficial for cancer risk reduction. And also it has some of a nervine stimulant for her. Now she does have some sleep issues. And so caffeine could be a contributing factor for that. So you may want to have either not do that or do caffeine free. And one way that you can remove the caffeine from the tea is by dipping the green tea bag, if you have a tea bag, and into the hot water for about a minute, and then pour that water off or give it to somebody else that doesn't mind having that amount of caffeine. And it's much less than coffee, but it's something to consider. So then we have chamomile, and that would maybe be something where she could drink throughout the day if she's stressed, or she could potentially have it before she goes to bed. But sometimes she could also have it with meals. Now, one thing that's really nice to know about this is it's very healing to the gut. In fact, in ibergas, which is a combination herbal that people use for healing gut for various reasons, they looked to see, and they found that chamomile was one of the things that healed out of I can't remember how many herbs are in there, but there's a lot. And chamomile was probably impacting most of it. Now she takes naproxen, and naproxen or any NSAID, non-steroidal anti-inflammatory like ibuprofen or diclofenac or naproxen, These things need to be taken with food, but drinking it with a cup of chamomile tea can lower the risk of irritating her stomach as well, and can protect it from possibly getting an ulcer. We do know that people do get ulcers from NSAIDs. It's one of the biggest cause of GI bleeds, which can lead to a very significant problem. Ginger has anti-inflammatory properties, and turmeric, both of those could be beneficial for her knee, along with an anti-inflammatory diet, which a plant-based diet generally is. And ashwagandha could help her with some of the stress aspects of that as well. And the turmeric has cancer risk reduction as well. And then ashwagandha is a relaxant for her. Peppermint helps with relaxation and pain, but we have to be a little careful because she does have that gastritis, and we don't know for sure if she's got some GERD, and we want to make sure that if it's irritating that at all. But I love peppermint. It tastes really good. Hibiscus, this is known as the sour tea, and this would be one where you'd want to take it maybe 2 or 3 cups a day, along with good lifestyle as well. Echinacea. It's immune modulating and antiviral. So in the times, this is not one that I would be taking on a regular basis, but I would take at like 1 to 2 bags is what I would do every couple hours early on. You don't want to start taking it 3 or 4 days into a respiratory infection. You want to hit it hard, hit it fast. And that's not unlike what we would do for other things. So if somebody has pneumonia, or they've got a strep, or they've got some other type of a infection, you want to go after it fast early, because just like with anything, when we go early and fast, or if we get treatment quicker, we're more likely to have benefits. And there's pros and cons and plus and minuses of various studies with regard to echinacea. And sometimes it's maybe because they haven't used a high enough dose, or started early enough, and used it frequently enough. And then, as I was mentioning before, you can use these as singles or blends. And oftentimes echinacea, if you buy some of the pre-mixed ones, or the ones that are, you buy, you can grow your own if you want. You can wild harvest it, but I wouldn't on this particular plant because of it's a at-risk plant. It's on the UPS endangered species. But it oftentimes, if it's in a package, it's oftentimes combined with elderberry and some other herbs. And I think one part of what we do when we eat and when we have a cup of tea, I think sometimes we've gotten into this really fast-paced life, and we just don't really appreciate the food. We don't appreciate the seed that it was grown from, the persons that planted it and cultivated with it, and harvested it and brought it to us to be able to buy. And I think that's a really important part of the preparation of the food or the tea. I think the ritual of maybe saying a prayer, or have a sense of gratitude before we eat. And the same thing is when we're doing a tea. I think a lot of people that drink coffee, they have a ritual. They get up in the morning, they go down, they make their coffee, they maybe read their paper, they might look out the window, they pet the dog, and maybe have just a few relaxing moments when they're doing that. I think that's a good thing to do with our tea and with our food. And it's really kind of interesting too. I don't know if you're familiar with Dr. Emoto. He was a Japanese researcher that looked at the crystal formations of when water was frozen. And when they were said a good thing, and they were praised and said love, and maybe sang to and said good things, the crystal formations were very beautiful and symmetric, and really, really quite amazing. And then that same person did studies on the water crystal formations of when the crystals were forming when they were sworn at or said something bad. And, we're like 70% water. And then we think about tea and we think about our plants. There's a lot of water in those. And if we can say our prayers, it's probably, or not necessarily prayers, but the gratitude or saying something good, and it could be prayers. It can potentially change the chemistry and the chemical structures just from that as well. So I think that's a really important part as well. I just wanted to share with you the SNAP program. This used to be called the food stamps. And, I talked before about that these plants, teas are the most common way and the easiest way to use herbal medicine. And sometimes, patients can't always afford maybe a tincture bottle or a glycerite. Little tincture bottles, little ounce tincture bottles are now somewhere between $10 to $20 per bottle. And with one cold, echinacea may take about 4 ounces to use. So that could be quite expensive if you don't make your own. So you might want to learn how to make your own. That could be another lesson sometime when we're doing it. But teas, especially if you're growing your own or harvesting your own or buying these, they're usually pretty, you get quite a few tea bags in a little box. And then for our patients that may be on the SNAP program, we could recommend these and they can go get them. And you can see some of the titles here. We have peppermint and breathe easy and throat coat. Throat coat is really very good for coughs and sore throat and gargling with it. And echinacea, we talked about that. And we have ashwagandha and we have green tea and astragalus tree. All these things you can buy them, the teas, and they're more economical when you're on this limited budget and if you have the SNAP program. This is just showing like a rainbow, and there's very many different colors, and I'm not going to go into all of these because we're getting close to being done, but we want to be thinking about how do we choose a tea. We want to make sure it's a good quality tea and perhaps coming from a third-party testing to make sure that there's no contaminants. We want to prepare it appropriately. We want to make sure we cover the cup so the essential oils are kept in, and we get the benefits of that. Sometimes adding lemon juice can enhance the vitamin C and the total polyphenol content of the green tea. And there are just so many things that you can think about. You want to store your tea. If it's loose leaf, you want to store it in most likely a glass jar in a dark, cool place, just like you do many of your food products is a dark, cool place. And then sometimes if you have the little tea bags, just keep them in the tea bags. So what we just went over was a lot. So we went over what is integrative medicine, what is plant medicine, various herbal actions, the different ways that we can extract the chemical constituents from that and prepare those for our consumption and use. And then we looked at teas and tisanes. We talked about the various herbal actions with a particular case, and then we looked at the rainbow. So I think we've gone really a lot into that, and the time flies, certainly for me. I hope that this was something that you found helpful, and I would like to open it up for any questions and Terry's comments.
Becky, you have packed a lot of information into that presentation. Thank you so much.
You're very welcome.
Let me just check I see a hand up. Grace had her hand up, and I think that's been up for a while, Grace. So I'm not sure if you're still there and whether the question you had has been answered or not. But if you'd like to unmute yourself and ask the question, you're welcome to do that.
Yeah, I think her hand has been up for the whole time since Dr. Lieberman talks, but it'll be interesting to see if she does have any questions.
Let's see. I'm waiting on Grace. We'll go to Jessica here. Does rinsing an herb remove any potential contaminants? And should herbs be rinsed the way that rice should be rinsed?
Yeah, I think always trying to not get contaminated ones, but sometimes if we're picking from our garden or picking it in the wild, you want to make sure that you're not going close to a roadside where there could be a lot of dust and who knows what. And also if there's any chemicals there, so you'd want to stay away from that. Sometimes rain potentially could be contaminated. Certainly a few weeks ago, we had a lot of the smog or fire air quality that was contributing to it. I think if you can gently rinse them off, certainly something like turmeric or ginger, you can certainly scrub those. But if you have something like mint tea, it's a lot harder to scrub it, but you certainly can rinse it off, but you just would want to do it rather gently and do it with clean water so you don't get any other chemical contamination from that.
Anna, would you like to unmute and ask your question?
Yeah, I thank you so much. It's so I'm from Poland. So Poland is one of the countries where we drink herbal teas, and and we love tea. So, but still a lot of new things, and it was such a good time to listen about all herbs and teas. My question is about there are some mushroom teas, actually, like reishi teas, and that they started like kind of being more and more popular on the market. They're a little bit different, of course. Mushrooms are different, but do you have an experience with those? Can you say a few words about that?
Yeah, I think mushrooms are really valuable for us. If you even just have like, I think 1 button mushroom a day, and those are not even considered the medicinal ones, they can help to lower the risk of cancer occurrence. And you would definitely want to get your mushrooms organic, because they tend to be, and they're, by the way, they're not plants, they're in their own classification in the fungi area.
Yes.
But you'd want to get organic because they tend to be cleaners of the earth. In fact, when there's like big oil spills, they'll throw mushrooms out there to help with the cleaning of that. So you want to get organic, and then they're definitely something that you'd want to consume. If you consume them in your diet, they should be eaten. I think when they're not cooked, you can increase some risks for cancer risk because of not being cooked. And then when you just use it as a tea, which I think is fine, you're only getting the water soluble benefits from it. And teas, when you use it in a tincture, it's usually what they call as a double extraction method, where they'll do a water extraction and they'll do the alcohol extraction, then they can combine it back in together with it. I've never done that as an herbalist, but that's one of the things that use of mushrooms that you'd want to do. But I do think mushrooms are just really powerful to include if you're not allergic to them. Some of us are aware of one of our teachers in the area of integrative and herbal medicine has a severe life-threatening mushroom allergy and has to have an EpiPen and has landed in ICUs for that. So there are people that have mushroom allergies. I do use some mushroom powders in some of my herbal balls that I make, like nut balls or that type of a thing. So it's the powder, so it hasn't been double extracted, so it's been dried. So good question. Did I answer that for you, Anna?
Yeah. So would you recommend like mushroom tea as a kind of like mild and gentle, I would say, introduction to mushrooms just in your tea?
I do think that they would be good. I do. I think, so for example, with wild harvesting, I'm not a person that would trust myself with most mushrooms, but I know that chaga, which grows on the birch tree, I have collected that, and that has some benefits for immune modulation as well as anti-cancer. Many of the mushrooms have anti-cancer benefits. Reishi is the king of mushrooms and has many adaptogenics, and I think it's one that really helps like for lifelong for using that. So I do think that incorporating mushrooms in as a tea would be fine, but just know that probably eating them, and also if you're going to continue to take them, it's probably in a tincture form. But I know that Paul Stamets, who's big in the area of, he's super knowledgeable mycologist out in, I think it's Seattle, and he does a lot of cultivation of them. He does have capsules, and he also has tinctures. But from what I understand is it needs to be that double extraction to get the biggest benefit from it.
Thank you, Becky.
Yeah, thank you so much.
We've got 4 or 5 additional questions here off the chat. So how can, from Malini, I think it is, how can we regulate the amount of regulate the amount of medicinal amount we are getting in the tea? So I'm sure it probably depends on the tea, but is there a way to somehow regulate how much we're extracting?
Yeah. Hi, Malini. So Malini and I are friends, and she's also a physician colleague of mine too. So thanks for the question, Malini. So if you do an extraction, if you do the timing of it, and also the heat. If you use a cold infusion, you're not going to get as much of the medicinal properties out of it as if you do a heated infusion. And also, if you put the lid on it, you're going to capture the essential oils, which also are therapeutic. And then the longer that you steep it for, that you're going to do it. And then depending on what you're using it for, you might want to use it more frequently as well and for a longer period of time. So it's not all across the board. Generally, if it's a dried herb, it's 1 to 3. And you can also look at some of the packages, what it might be saying as well. So yeah, you get different amount for that. And then of course, the quality of your herb too. So if you have an herb that's been sitting around for a year or two, or if it's been in an open package, it's going to start breaking down and losing some of the benefits from it. So if you open up a fresh bag, or you just dried some herbs and you open the bottle or the bag that you've gotten it from, you can smell that freshness versus something that's been sitting around for a long time. You can see that, you can smell that it doesn't probably have, it's not as going to be as potent. So also, as herbs get older too, they start looking older. They don't look as fresh and bright green or fresh and red, or in that way as well.
Yeah, next question is, a nephrologist told me that tea is a bladder wall irritant and a person needs to drink 2 times the amount of water to tea intake. Is that a true statement?
I think some teas could potentially be a bladder irritant. Green tea, the caffeine part could be a bladder irritant. And so, some people do really get affected by that. There's something called interstitial cystitis, and then just a bladder irritant in itself, and it might cause more frequency, even though you might not have that much volume to go. So I would say there are some that are probably more so, and like the citrus, just even drinking citrus drinks might cause more irritation to the bladder. So you'd want to, test it out and see, does this seem to bother me? And if it does, then I probably wouldn't use it, because just the same for anything, like certain foods, like I love eggs, but I used to be able to eat them many years ago, but I don't eat them anymore for a variety of reasons, but they irritate. Like about an hour or 2 later, I would get that stomach ache. Or the same thing is with certain other foods that you just want to pay attention to it.
Carol asked what teas would be helpful for tooth gum issues such as soreness, and would you use them as a rinse?
Well, our dental health is really important for our overall body health. So there's something called translocation of the bacteria that can go from the mouth to the heart. They've actually been able to biopsy the vessels and find that there might be bacteria that's in the mouth and the heart. So you always want to have really good dental care and, caring well for your mouth, brushing and flossing and getting your dental cleanings and checks and all that type of thing. I think as far as any particular one for like if you had a toothache, people oftentimes use like clove oil. It has analgesic properties, and that would be more in an oil. You could probably make a tea out of it too and gargle and rinse. Some people do kind of a lot of swishing around of that as well. So I would say anyone in particular for your gums, I would say maybe like I'm sure there are some that you could use more. That I'm thinking of as maybe the marshmallow root would certainly help if you had irritation to your gums. It would help with the healing of it with the mucilaginous aspects of it. It is a carbohydrate though, so you'd still want to do your brushing and not just go to bed after you've rinsed with a tea or whatever, because they do have carbohydrates in them.
Barbara asks, what are the benefits of dandelion?
Oh, dandelion, what a beautiful plant. As a little kid, we used to always put the little flower underneath to see if we liked butter. And, they're so pretty, and they really get a bad rap from strict, beautiful yard keepers that want to have their yards really, really green and without any kind of weeds in them. It is a weed, and it's a beautiful weed, and the flower can be eaten, and the sap has some maybe anti-wart properties to it, and the leaves can be used for a tea. and you can get benefits for, it's kind of bitter, so it can help with the digestive processes. And it also has some diuretic properties to it. So some people use it maybe for that purpose. And you, if you were using it consistently, you could maybe need to follow your potassium, because I think you can still excrete potassium from a diuretic. The roots are oftentimes used for liver protection and general kind of detox properties. So that the whole plant can be used. People make dandelion wine. I've never made it, but there's a lot of different properties. I love dandelion. And also the leaves are just so good when they're early in the spring, if they haven't been, put pesticides on or herbicides or something that's caused a contaminant on it that would make it dangerous. But they really taste good if you like a little bit of bitterness in your salads, which also helps to stimulate the whole digestive process. But for teas, you could use the whole plant, and you can also eat the flowers as well.
Great. We've got, I think, 3 or 4 more and just about 3 minutes left. David says, any comments on, I think it's holy basil, and in parentheses, he put tulsi tea, and it benefits.
Yeah, it's also known as Ossicum sanctum. It's holy basil. It's oftentimes used, and I think one of my colleagues who's of Indian descent likes that plant. It's used often in, the ceremony and spiritual aspects, and it has a respiratory affinity. It has many benefits for it. It's so it's not really in the same thing when you think of basil that we eat and make pesto out of, but it has calming properties, and I really like it a lot. I like it a lot. It's got kind of an unusual taste. It took me a little while to kind of like it, but I do grow some of it and dry it.
Vicky asks, or Vicky says, to me, there's a difference between plants, teas, and herbs as a component of a lifestyle and comfort versus positioning them as alternatives or replacements to drugs. Having been trained in grad school in pharmacology, I'm a bit skeptical about the claims that relate to cancer prevention or anti-inflammatory properties. That said, what do you consider the best peer-reviewed sources of scientific evidence that evaluates and characterizes effects of plants, herb, and tea extracts in a scientific manner?
Well, that's just a really loaded question. Are you done, Terry?
Yeah.
Wow. Well, I'm impressed with your training. You probably should be looking into the literature with the knowledge that you have, so you could really make sure that you can learn more and understand and share with all of us with that background of knowing. I would say always going to PubMed is a good place, and doing like a literature search that way. You sometimes can even do Google searches, which will ultimately get you to some of those things as well. And you can use Google Scholar, but I think PubMed will be a good start for you. And you would start by just looking at the literature and just saying the evidence behind the use of echinacea for colds and flus or colds. The more specific that you get, and then also having an understanding of it. So if you don't really understand, the more you understand, I should say, about the folk use of it and the traditional use of it, I think it will give you a good basis for it, and it will help to open up your mind not just yours, all of our minds, to understand that these things have been used around the world for a long time, and that more and more science is coming and benefiting, and there is much literature out there. So I would say get a good search and use a search engine or a search such as PubMed. The National Center for Complementary and Alternative Medicine, and I think it's a different name right now. I think that's the name, but they have some good resources for you to start as well. And going to I'm blanking on it's a federal government website for supplements, and it includes both herbal and non-herbal supplements. I don't know if anybody that's still on there can help me think of what it is. I just can't come up with it, but there are those sources for you, and you can start out by getting an overview, and they're oftentimes listed with multiple research that's there. And then you want to start looking to see who are some really good herbalists out there, and see and go and start reading from them. And lots of times they have the references. And at the end of this presentation, down here, you can see that we have the Journal of Alternative and Complementary Medicine for a systematic review for the use of ashwagandha. And then we have a double-blinded randomized clinical study. And just like with any studies, there are good and bad studies, and there's a way to determine whether they're good and bad. But you can see here's some for astragalus root, here's some for echinacea, and you can go back and just see the variety of references here. And it's not exhaustive, believe me, it is not exhaustive. And but thanks for the question, and I hope that helped you go down a path a little bit of the way.
Right, and she did finish by saying she is open to learning. So you've given a number of places to go to get that.
Yeah, and I would say just to start too is go and look at David Hoffman. He's an amazing phytochemist, I think is how he refers it. He's from the UK originally. I think he's maybe living in California, and he is just super smart with all of this. And, you know, I'd like to put my head up and have osmosis with regard to him. And then a recent herbalist died by the name of Stephen Herod Brunner, and did a lot with Lyme disease and viral herbal medicines for viruses and bacteria, and just a wide variety. And he died within the last, I think definitely within the last year and maybe the last 6 months. But if you go to any of his work, you'll see that it's very highly, it's amazing. It's very technical and lots of evidence to support the claims. So I think that might be helpful for you.
We are a few minutes over. Becky, if you're available for another 2 or 3 minutes, we have like 4. If we could do a lightning, kind of lightning round.
Yeah, and I just want to say, don't forget, tonight we have the Northern Lights. The Aurora Borealis is supposed to be visible if we look into the northern sky between 10 and 2. So when we're done, it's not yet. So, but it's going to be. I'm certainly hoping that we can see that. So that would be.
Thanks for the reminder.
You're welcome.
So Barbara asked, what tea is good for pelvic pain?
Well, kava was, I think, originally brought into the United States for it helps with relaxing muscles, and specifically the bladder muscles can be benefited from it. It also has other nervine relaxant benefits as well. So from a plant, from that perspective, that may be beneficial. There's also it doesn't necessarily help with the spasms, but it helps to maybe the lining is with the marshmallow root, where you would do a cold infusion, and so that could be beneficial. Anna
mentioned sage for toothache and gums. I think that was in reference to another question that had been asked. And then we've got 2 last ones here for the lightning round. Our Deborah said our detox teas good for cleansing the kidneys. Our detox teas good for cleansing the kidneys.
I think it could be. I would want to know what tea you're thinking about. I think when we detox, we always want to start with not bringing it into our body. And the detoxification of not, going more organic if you can, rinsing things off, rinsing with diluted hydrogen peroxide, or even vinegars can help to do that. So that helps to start the cascade. And when we detox, we do want to make sure that all of our detox pathways, including voiding with our kidneys and stooling with our feces through our GI tract, and through breathing, which is where we can expirate things out. And then our skin and sweat are some of the biggest detox pathways. And I do think that there can be things that can help us to detox, and dandelion may be one of those for the kidneys.
And Deborah mentioned that the Yogi brand is the big teas that she's seen for detox. And Jessica added in, I think in response to Vicky's question, Cochrane COCHRANE, has several good reviews available for specific questions.
Yeah.
I think you might mention that, Becky, and that.
I did. Yeah, I didn't mention it, but Cochrane is a very respected way of looking at reviews as well.
And a natural medicine database compiles a lot of primary literature as well. And the NCCIH website is the government website that that you're
Well, thank you very much. Sometimes when you're just sitting here thinking about it and it's the end of the day, your brain doesn't work quite as fast. But yeah, those are really good recommendations. Thank you for participating, as we are all part of this group together.
Well, Becky, thank you so much for that excellent, valuable information and for answering answering these questions tonight. And I'd just like to want to remind everybody, our next monthly meeting is going to be Thursday, August 10th at 6 o'clock Central Time. Our featured speaker will be the head of the Rochester Lifestyle Medicine Institute in Rochester, New York, Dr. Ted Barnett. If you'd like to receive notice of this and other upcoming PB Now events and are not currently on our list, just Google us at PB Now or pbnow.org. Once you're on our homepage, click the white Learn More button to register, and you'll begin to receive notice of our upcoming meetings. Also, remember that if you'd like to check out our past meetings, just go to the video library section on our website or search for us on YouTube under PBNOW or pbnow.org, and you can go back and watch entire talks or just skim through talks to the parts of each presentation that might be of particular interest to you. Thanks again to our featured speaker, Becky Schultz, and our PBNOW Medical Director, Dr. Josh Lieberman, for sharing their valuable time and knowledge with us tonight. Good night, and thanks to everybody for coming.